Now I'd like to welcome our next researcher to the podium. We have Dr. Joshua Trigg, who's a researcher and lecturer in population health at Flinders University and Medical Research Institute in Adelaide. His work focuses on modifiable health risks and risk attitudes and motivators of health risk behaviours. Current projects address tobacco control policy, nicotine vaping, and mental health considerations. So thank you, Josh, and welcome to the podium.
Thanks everyone for still being here at this end of the day. And thanks Heewon for jumping in when I was mysteriously absent. I'm going to present on some work that I have some placement students working on at the moment. So I'd like to acknowledge them. I did put my name at the front of this because it's a template that I use, but Benjamin did a lot of the work here. And I'd like to also acknowledge Sajal and Amy as well. So today I'll be talking about a brief scoping review that we're all working on together around phasing out of retail tobacco sales. So looking at bans, looking at kinds of bans as well, and having a look more so at the enablers and barriers that the authors of these studies have pulled out when it comes to the implementation of these things. And so this is still underway, so it's preliminary results. I'd like to first acknowledge the traditional owners of the land on which we conduct this research, so the lands of the Kaurna people in South Australia, and I'd like to pay my respects to them as well as the First Nations owners of this unceded land here as well. So for context, and we've heard a fair bit about this already, there is this tobacco endgame approach of looking at how to cease tobacco sales, whether that's via policy, something externally imposed, or there are other measures where you're trying to incentivize groups, individual retailers to voluntarily do so. Australia's got a target daily smoking rate of 10% by 2025, and we still sell loads of cigarette sticks. We all know that tobacco is readily available, that it's very, very bad. It's the single biggest driver of the tobacco epidemic. And so this idea of a market supply tobacco endgame policy measure, whether it's phase out or a ban, is something that we really need to work towards. And a number of speakers here have mentioned that today. So policymakers need to consider relevant implementation factors, learn from previous examples where bans have been put in place, whether it's jurisdictional or attempts at voluntary ceasing of sales, in order to effectively design and prep groups, locations to cease tobacco sales. And we have got international precedent. Obviously, there's all sorts of examples. People here will be familiar with the Beverly Hills and Manhattan Beach examples. And then at the individual retailer level, we have a study that's been done around specifically trying to get people to voluntarily cease tobacco sales with some support. And that happens to varying success. And before that, we do have other examples of things that could be considered bans as well. So we were looking at both bans and phasing out. And so we focused on high-income countries. I know that we need to focus on low-income countries here, but that was outside of the scope of what could be done here. We did find some studies from Germany, so we included those. And we looked at things that were considered phase-out as well as abolition in some cases. So studies from 2013 to 2023 indexed only via Scopus at this point. There are other searches underway in other databases. And then the students did digital screening and extraction as well. We ended up with 16 eligible studies, primarily from the USA, New Zealand, and then in Australia and the UK, Germany. Germany, we had some as well. They're primarily cross-sectional surveys or qualitative studies, and there were 2 reviews in here, which have been captured in here ones, I imagine, as well. The focus of the studies were largely around public opinion and support. We know that retail bans and phase out aren't particularly appealing to people. There are other options that are potentially more palatable. We also found studies on retail reduction or ban effects, so looking at them after the fact. There were a couple of reviews on the policy evidence that addressed this, as well as other endgame measures. And then there were studies that involved expert consultation and appraisal, which some people here may have been involved in. And there was one study in Tasmania that was explicitly implementation focused also. So the samples included adults, tobacco retailers, tobacco control experts, and then one was the perspective of students. We did find some studies, one from Pakistan and another one from, I can't recall right now. We may look at integrating those as well, but they were outside of the scope here. Most were funded by government bodies or non-profits or philanthropic organisations. and they mostly had no interests declared, except for a few which said they're explicitly working against the tobacco industry, and one had worked with the pharmaceutical industry as well. We looked at classifying them according to full bans, so like jurisdictional, partial bans, so like pharmacies, types of retailers, and then reduction, looking at addressing proximity and density. And so we found studies that looked at banning it across multiple retailer types, voluntarily getting retailers to cease sales, pharmacy retail specific bans, bans within alcohol licensed premises, and then proximity limits, so around schools and things like that. So one slide on barriers, one slide on enablers. So from the barriers, summarised from the studies that we found that obviously, as we've heard over the last couple of days, variable political support and political will is an issue and it always will be. So that's something that was identified in a few studies. Inconsistent retail environment policies across jurisdictions. You can't transplant something from one place to another easily, as we know. Retailer perspectives on ban exemptions. So it can depend on what types of businesses and what types of locations. Then we have issues that have come up multiple times, like perceived revenue loss compared to actual sales data, as one of the presentations here addressed. There's low evidence on equity impacts of ban approaches, so that's consistent with what Hewan was mentioning. Low evidence on policymaker implementation preferences, what they'd like to see. And then we have retailer business preferences. So are they thinking about selling their businesses? What do they want to do with it? What sales models would they appreciate? What's the viability for their business if something like that were to happen? And then we have demography-focused approaches as well. So things focused on socioeconomic gradient, impacts on different racial and ethnic groups as well. And then one of them mentioned the assumed right to sell tobacco products. It's something that they have the right to do. They feel that they have perceived community value, and if they don't do it, somebody else will. So there are various barriers there that you need to get past. For enablers, as we can tell from other presentations, embedding a phase-out or ban approach within a multi-policy intervention would be the best way to go, according to some studies. Broad consumer support for phase-out or ban in large-scale surveys, they're less appealing than other measures. I like this idea of the thin end of the wedge, and so this was something that has been talked about in relation to New Zealand, so trying to get more palatable policies across before you look at more controversial policies like types of bans and phase-out. Strategic communication to produce self-persuasion. There was a study that looked at how to get the public to experience enough dissonance to persuade themselves. It was an interesting one, but it was potentially relevant to retailers' perspectives as well. And they specifically asked about ceasing retail sales in that study. Larger retailers may be less impacted by a ban, so what types of retailers could absorb losses in different ways? So that means we need to talk with retailers around what they can do or what they might be able to adapt to. And then modelling studies support a ban role for the end game, as we now know. Access to tobacco licensing data for voluntary phase-out. So keeping tabs of which retailers are doing what is important. So you can ask people to voluntarily provide information around what they want to do, what licenses they hold, but you need to match that up with something that actually can tell you where they're at. And that's different across different jurisdictions. And then we've got strategic roles for transition. So some studies have resourcing, so project officers and community advocates, getting people to actually deliver these interventions and guide people through it is something that works, but it's something that is resource intensive and there's not much evidence on it. And then strategic partnerships to increase political will and policy adoption. So non-profits is a good one. Thank you. So the implications are that we need more evidence, specifically around ban implementation test cases. We need to look at different intervention techniques for different retail environments. And we need to look at the difference or matching up of objective data versus perceptions, because the perceptions will still drive retailer decisions. So we can look at sales, shopping behaviour data and the like. Implementation evidence with higher sales volume tobacco retailers would be super hard to get, but that's something we would really, really value when we're looking at what barriers might be relevant there. And then the estimated role of phase-out barriers can be compared with the actual role, so perceived versus actual sales impacts, getting rid of dispelling misconceptions. And then more evidence is needed on non-regulatory interventions, and that's something I'm particularly interested in. So phasing out tobacco retail outside of external compulsion, so policy measures, trying to look at how to get retailers to do this voluntarily. And I know there are others here working on that. And so we want to know what the requirements are of enforcing a ban after implementation as well. So it's not something that you just want and done. Things change, political environments change, retail and consumer environments change as well. So more research on sustaining these things. Again, very, very brief scoping review. We will be getting more evidence here, and we haven't done a grey lit review yet for this. So if you have anything interesting, feel free to send it to me unless we find it. And that's all from me. I'd like to thank the CRE for their support and students as well.
No questions? Everyone's tired at the end of the day, I think. Oh, here we go.
Yeah, great talk. Thank you. I had, did you find anything in the literature about, I know this is about reducing the number of retailers, phasing out tobacco from the retailers, whether they would swap out their product with nicotine products?
So we didn't explicitly search for that. I think that might be something that is included in some of the studies we have, but that wasn't something we've focused on here.
So as a business model for the retailer, it might be, I'll take this more harmful one out and have this instead. So that was the, and ages ago, I can't remember when I first started looking at this again a while ago, in New Zealand, there seemed to be, if I remember rightly, some of the smaller shops had contractual agreements with the tobacco industry which were fairly binding. And so their hands were a bit tied. So that might be something that the legal people could be looking at. I don't know that, like I said, that was a while ago, and I don't know if that still exists or if it exists in all countries.
So we have, well, we're trying to get a survey out there at the moment with retailers in South Australia that has some questions that are kind of obliquely looking at things like that.
Do we have any, I've got another question over here.
I think this is a really great scoping review, and I'm really interested in your outcomes. Where does Hungary sit in your inclusion criteria? Because they did it, didn't they? They reduced by 80%.
Yeah.
I mean, I'm sure there's all sorts of complexities there.
Yeah. So definitely should expand the inclusion criteria to include Hungary. So they're excluded from this one at the moment because of our arbitrary search criteria that students were working to. But if we should include it, we should include it. So yeah, I'll notice that.
Okay. Any other final questions? Okay, well, thank you, Josh.